Joining us today. This is the first webinar of our Grandfamilies and Kinship Support Network, a National Technical Assistance Center. And we're so pleased that you all could join us today. I won't start talking until I see that people are in from the waiting room, and then we'll get started. We've got a very popular webinar today with Dr. Cross from the National Indian Child Welfare Association. Thank you so much if you're the one that did this.
Yeah, it was all me. It's got really busy as soon as you walk. Just wanted
as what your previous contributor mentioned, everybody very few people.
Well, it looks like we have a nice critical mass and people will start coming, will continue to come in. But we are going to get started today. And as I said, today is our first webinar of the Grandfamilies and Kinship Support Network, a National Technical Assistance Center. And we're so pleased to have Dr. Terry Cross of the National Indian Child Welfare Association with us. If you're not speaking, if you will mute yourself, that would be most appreciated. We are going to pause for questions throughout. And as they occur to you, you can put them in the chat. And then when we pause, I will read them out to Dr. Cross so he can answer them and discuss them. But we will pause for questions throughout our time together today. And as you're comfortable, if you turn on your video, and just a reminder to mute yourself if you're not talking, because we're hearing a little bit of interference, but we do want to keep this interactive. So thank you. Just a little bit about us, and I assume probably most of you already know some about us because that's likely how you heard about this webinar. But just as a little refresher for those who already know, and perhaps an introduction for those who don't, we are the Grandfamilies and Kinship Support Network. We are the first ever National Technical Assistance Center on grandfamilies and kinship families, by which we mean interchangeably grandparents, other relatives, close family friends who raise children when parents cannot. And we at Generations United, along with partners and subject matter experts like Dr. Terry Cross, have received a 5-year, $10 million cooperative agreement from the Administration for Community Living at the U.S. Department of Health and Human Services to run this Technical Assistance Center. We are going on our first anniversary. And we have gotten quite a bit done this year, including talking to every state, Puerto Rico, Virgin Islands, DC individually, and then having a series of regional and tribal convenings and learning really about your challenges and needs so that we can respond to them. And that's why we decided to launch this webinar series, which will be many years now, because this is a 5-year project, to launch it with Dr. Terry Cross talking about the importance and how to collaborate. We've been working at Generations United on behalf of grandfamilies and kinship families. And again, we use those terms to mean the same thing for over 20 years. And what we've seen over those 20 years is that agencies and providers aren't working across systems to help the families. You know, there's silos, there are barriers. And so this webinar and our work is getting at how to collaborate more, how to break down those barriers, and how to truly help the families now and into the future. And if you're not part of our list and our newsletter list and have access to our resources, please sign up. There is a link on this slide and the QR code, which you can just put your phone up to and access that sign up form. And Allie will also drop it in the chat for us. We do a number of things here at the Technical Assistance Center, including this new webinar series, which we're just launching. We're also going to have learning collaboratives around issue areas. We provide individual assistance, and you'll see Emily Sigmund and Shayla Bottoms, who are on this webinar today, and they are our crack TA team, and they have access to many experts to help answer your questions on an individual basis. We also are going to be doing elevating promising practices from around the country through an exemplary practices application process, and providing more targeted support in 3 jurisdictions where we're really going to go in and work with all the systems. So our website, our new website, is due to launch within 2 weeks, likely next week. I'm a little reluctant to say that, but at any rate, you can see the URL, the website address on this slide deck, and do realize it's not live yet, but it will be very soon. As I mentioned, we do this work with a number of national partners, the National Indian Child Welfare Association being one of the most important of our partners. And we are so pleased to have today Dr. Terry Cross with us. He is known in the Seneca language as Hanigano, and he's an enrolled member of the Seneca Nation. He received his master's degree in social work from Portland State University in Portland, Oregon. He's the founding executive director of the National Indian Child Welfare Association, NICWA, and he now serves as a senior advisor. He's the author of Positive Indian Parenting, and he co-authored Towards a Culturally Competent System of Care, which was published by Georgetown University. He has 49 years of experience in child welfare, including 10 years of direct practice. The Grandfamilies and Kinship Support Network, our National Technical Assistance Center, is honored to have Dr. Cross as one of its subject matter experts, one of our subject matter experts. And I am so thrilled to turn over the webinar to him now. Dr. Cross?
Well, thank you very much. What a great turnout. So congratulations on having so many people join us today in this launching this webinar series. I'm going to share my screen and share slides. I'll say just a little bit about my presentation style in this Zoom format. I will present 4 or 5 slides, and then I'll switch the view so you can see those and pause for a question or two, and then launch back in to the presentation. So to get started, I will share my screen, and Anna, you can give me a thumbs up if you are seeing that. Okay, we good? Aha. And let's make it slideshow view. There we go. So off we go. So answer the question, what do we mean by collaboration? Well, it's a strategy that enhances our ability to accomplish our mission. We have a set of principles in collaboration at NICWA, and one of those principles is it has to be win-win or no deal. In other words, it's got to be good for both organizations in order to strengthen our services. So it's a decision to act jointly, to work jointly at a common cause. And that common cause is making sure that children and families get what they need. It's a type of coordination and cooperation that results in each agency or program benefiting and giving better services. And for us in our work with our tribal communities, it's an approach that really supports and honors our tribal sovereignty and our culture, because it allows us to respond to needs holistically. And Anna mentioned that too often services are in silos, and being able to give holistic kind of services that families need is a challenge. So some key points we're going to be covering in this session today: that collaborating programs develop a shared vision for positive outcomes. You'll hear me talk several times about the need to sort through. This is a leadership issue, and we'll come back to that. And collaborative programs, they develop processes for this joint work. It's great to have a vision to do it, but if you don't put together the nuts and bolts, you can't sustain it. And collaborating programs need to budget for this work. Collaboration isn't free. It takes people's time. It takes getting together. So making sure that your programs set aside the right amount of funding to do this. Collaborating partners are accountable to each other. So reciprocal agreements around accountability and having routine checkups. And then we're going to be talking about collaborating partners, adapting to the needs of the community they're working in, their families, the children that we're serving, in this case, the grandfamilies and the unique issues of those families. So, why collaborate? Well, children tend to get better care when the adults in their lives cooperate. It works in families and it works in systems. So I'm going to pause there for a minute. I'm going to drop out of this mode, look at these 4 slides and see, do we, any thoughts, any comments, questions? I know it's early in the process, but maybe there's one.
Thank you, Dr. Cross. We have a question about when you talk about adapting to the needs of families. Can you speak a little more about that?
Yeah, and I'll really go into some depth on this because the families that come to us, grandfamilies, have a broad number of concerns. And in order to meet those concerns, we have to get out of our silos. So we may actually have to come up with creative solutions to, for example, joint staffing across departments or organizations, and making sure that, say, one of our, one partner is able to meet a need that another partner can't. So the flexibility in that adaptation process. And I used the example in a grandfamily placement in one of our tribes, a family group conference that was actually hosted by the child support enforcement. There's some discussion about whether the father of the child is going to pay some kind of support. And in this family group conference, he said he couldn't afford to pay. And grandma said, well, you can cut wood, can't you? And yes, indeed, he could cut wood. And so the collaboration was for the child support agency to develop an agreement with father for in-kind services. It was quite an innovative approach at the time. Thank you, Anna. I'm going to jump back in, and you'll see my pattern of stopping. And so think about it as we're going along, and I'll get back. Here we go. So more reasons to collaborate. I already mentioned families get better services when they're coordinated. Now, a big reason to collaborate is resources are scarce, and duplication or poorly coordinated services are wasteful. So we can get a much better return on our investment if we are doing it in collaboration with one another. Now, and here's probably the most important reason for doing this, that the challenges that grandfamilies face are too complex to solve without a comprehensive, coordinated, and holistic approach. And this is really systemic care language, to provide an array of services that address the issues of loss and grief and healing, but also housing and income and whatever other services might be needed by families who are often taking on very complex jobs. We hear from grandfamilies, for example, about relationships with the schools, or having to find resources to support recreational activities or talent development activities like athletics or music or things like that. A whole range of things to help families. So every family, every kinship and grandfamily is important and deserves support. We can't, I think, understate the importance of relatives stepping up and making children and their families are safe and taken care of. And our jobs are to make sure that they can do that. So that's the reason for this collaborative support. Unfortunately, in child welfare, where most grand families are served initially, um, grand families receive very few poverty reduction services. So many grand families don't feel they can provide the care for one of their relatives, or they may end up in the situation where they're caring for a relative and they don't simply have enough resources. They may, that we've heard from grand families already in our work this year about how important housing is, that it is essential that they receive some assistance with housing, but there's very few housing related services available through the child welfare system. Grand families receive very few mental health services. Kids not receiving the help that they need with loss or grief or with relationships with their siblings or their birth parents, or their relationships that can be very complex. And grand families receive very few substance abuse treatment services. And this may be the need of the child, it may be the need of the birth parent, or even within the grand families themselves. We had work in a family group conference deciding about who was going to care for a relative, and a grandmother stepped up and said, if I go to treatment, can I be the resource? And everybody looked at each other and said, well, let's talk about that. Let's consider it. So but there's very few of those services available to families who want to start the healing process. So I'll stop there, and once again, anyone have thoughts or questions about this? Why collaborate? And then I'm going to get into an example here of one of our other partners.
That sounds great. Yeah, I've gotten questions about whether the slides will be available, and they will be. They'll all go out. They will go out to each of you, anyone who registered, actually. I don't think we have any other questions at the time, unless anybody would like to come off mute and ask Dr. Cross something, or type it in here at this. Oh, here we go. Yes, that's a good point. Julia Brown points out that this goes beyond child welfare service gaps and into gaps in services for older adults. And I bet that's where you're heading. Am I right, Dr. Cross?
Well, and certainly the number of kinds of challenges, whether whichever service or whichever system has the lead, the gaps across systems are felt poignantly. And unless we do something very intentional about closing those gaps and getting agencies to work together, it's unlikely that we'll solve those things without collaboration. Thank you. Okay.
Dr. Cross, we have one more. Wondering where the data was found regarding child welfare service gaps.
I will have to follow up with that. I have that in another presentation. And I've used that slide for a long time. So I'll get that back, and we can get it available to people.
Thank you.
So I want to talk about next an example of a collaboration strategy that was developed by the National Center on Substance Abuse and Child Welfare. NCWA has partnered with the National Center that's operated by the Center for Child and Family Futures. They're a partner in our Technical Assistance Center. And Nancy Young and I have worked together for 20 years. So and I want to share their model for collaboration across agencies that treat substance use disorders and the child welfare system. So they talk about system level policy efforts that support the practice innovations in collaboration. So they describe these 5 steps, commitment, or these 5 elements of commitment to shared mission and vision, effective cross systems communication. We have to talk with one another, there has to be ongoing cross-training and staff development in each of the sides of the equation. Sustainability and institutionalization of practices. In other words, making sure that you have some regular check-in process, a regular accountability process, and then measuring and monitoring outcomes and sharing those with one another. I'm going to go into more depth in each of these as we go along. I want to share this at the practice level. The early identification of families in need of substance use disorder treatment, timely and equitable access to assessment and treatment services, recovery support, family-centered treatment services, and frequent monitoring and responses to behaviors. Now, you could take in any of these other services that might be engaged in collaboration and plug them in here. So early identification of children's mental health needs, for example, or early identification of domestic violence issues or of mental health issues or of housing or hunger, or so it's that early identification. It's having an assessment or screening process, being able to be responsive, and frequently you'll have a whole array of these needs where there are multiple needs to collaborate across multiple agencies. So looking at this shared outcomes in the model for working with substance abusing families, this, the shared desire is for recovery, and that parents simply are able to better fulfill their roles when their substance use disorder is under control or managed, and more children remain at home throughout the program, and through participation, their reunification is higher, so children stay fewer days in foster care, and the fewer children experience subsequent maltreatment, and fewer children re-enter the system. And these, I don't know how often I've talked with grand families about the pain that they feel in having their own children suffer from a substance use disorder and needing the help if they can get it. For some, and we have some of our advisors on this project, are families who have learned to have their birth children involved resources for the children in their care, but that because of the degree of their substance use disorder, that they just aren't going to be able to raise their children. So coming up with those shared solutions is a really important part of looking at this from a shared outcome. So what are some of the practices? Well, this is one of the staff training issues, having a constant screening process for trauma, for substance use disorders, for prenatal substance exposure or domestic violence, and to know how to engage with families who have experiencing these disorders, challenges in their life. Then routinely recording observations and questions, and supervisors and staff consistently monitoring case records and monitoring them for shared outcomes, to simply ask the questions. And in many cases, this means routinely sharing with court staff. We had a collaboration in one of our tribes we were working with across the drug court, the child welfare program, and the local drug and alcohol treatment program. And with a very successful outcome across all of those. But the court was essential in making sure that the, uh, the collaboration was working, because they had the capacity to use their authority to set up all of the meetings that needed to be set up. So it was each system that comes into play has different capacities to help collaboration be real. And it means we have to maintain relationships across providers. So one of the main principles here is that these issues they're urgent. We deserve our attention, and particularly in the substance misuse areas, it is essential that we have strong standards of practice and everyone working together for safety and well-being. So another of the principles is our success it is possible and feasible, and staff in child welfare or TANF or the substance abuse treatment or mental health, court systems, maternal health, all of them, we have a strong desire to help the families that we're working with, and when we come together, that we can change people's lives in that holistic approach. And family members, grandfamilies, are active partners and participants in addressing these urgent problems. And I want to emphasize that our grandfamilies want healing for those that they love and need the support, not only to take care of their the children that they're asked to called on to care for, but their lives get much easier when everyone in the extended family network gets the help that they need, and it becomes a process of healing for everyone. So there's a number of premises that the National Center's model is based on. Team is made up of people, and people make decisions, not the tools. So it's not, our practice relies on our ability to think and to talk and to problem solve. Checklists are great, and they help us not miss things, but they're not the best decision makers. And the entire family has to be the focus of concern. And in families, problems don't come in discrete packages with boundaries. They're all jumbled together. And that's why collaboration is important, because it helps us be responsive to those intertwined issues. And assessment's not a one-person responsibility. And we point out here that when tribal children are involved, it might even be decision-making across more than one jurisdiction. So I'm going to stop there. I've covered a lot of territory. Thoughts or comments about these?
We're getting a lot of discussion in the chat about, those many families that are outside child welfare involvement. The majority is out there. So a lot of discussion around that and what the kinship families need outside of child welfare involvement. And then some more concrete questions as well. One of the audience members talks about how the child welfare workers need to be trauma informed and have knowledge of child development and understand that grandparents make the better choice for care and that they need legal resources. And then we have a question, are ROIs or issues of confidentiality a barrier? They
certainly are. We're going to talk about those barriers in just a moment. And there are ways to structure to work around them and to engage families actually in the process of breaking down some of those barriers. I'll come back to that in just a minute. With regard to families outside of the child welfare system, this work on the with the agencies providing treatment for substance use disorders. Your partnership is often with maybe with a court in a drug court situation, for example, or it may be with other mental health agencies. So collaboration is, as Anna said, I've been in child welfare for 49 years, and that children's mental health. And another of the curriculum that I have authored is working with substance abuse in families. So it's a focus that I have from my child welfare point of view. So I would certainly call on people from other fields to think about and to offer. Perhaps we can call on people in a future webinar, the use of collaboration from other fields. So Anna, let's make a note of coming back to this one. So,
Thank you.
Yeah.
One more question. How do we engage youth service agencies to be more supportive and collaborative with kinship support agencies?
Good one. Well, it takes that coming together to have a shared vision. And I mentioned, and we'll talk a little more about that, that this is a leadership issue. If people at the top levels of organizations are not talking with one another at the vision mission level of the conversation, it's very difficult for line workers to get to collaboration, because it's the structural barriers that get in the way of people working together. There's a lot of collaboration that happens naturally in smaller communities, particularly where different agencies may be housed in the same building, or in some cases in the same office area. And when people have the opportunity to talk with one another and to share with one another, they often figure out how to collaborate, even though there's barriers. But it's really up to leadership to make the space and protect that space so that people can have things like joint staffing meetings, wraparound approaches, family group conferences where families are meeting with a number of service providers and making full participants in the plan about who's going to do what when. These are the barriers can be overcome by this decision to act jointly. And when when leadership in an organization from the executive level to the middle management level to the supervision level, these are all important players. We'll talk a little bit more about that buy-in. So I'm going to jump back in. I see that we are about half an hour into our work. Oh,
We have an interesting point here, though, which I
Okay.
don't want to lose, so I'm going to elevate it with you.
Yes.
Collaboration takes a lot of time and funding, tends to be very focused on numbers of people served. So it makes it difficult for staff to have time for collaboration. The systems need to fund the time required.
Yeah.
Yeah,
I think that's key, and you're right on. Is my point about making sure you budget appropriately for collaboration, and if you get 3, 4, even 5 different systems in the room, sitting with a family making a plan, the cost of that kind of meeting is very high. It's the return on investment that is so important to keep in mind, that each agency is accomplishing its mission by being at that table, and that not only are they there accomplishing their mission, they're developing a partnership with someone who can advance their mission on the ground in real time with kids and families, and that's the grand family. You know, like one of the principles here is that it doesn't matter what agency you represent, you can be in the family's life perhaps a few hours a month. And it is the care provider. It's the grandparent or the auntie or the sister or brother who's providing care, who's got the other 29 days and 16 hours. It is a what we're doing here is bringing a system together around the capacity of a grand family or a kinship family to provide the care that's needed. And if we fail in doing that, the care only gets more expensive because the problems that families face don't get better and become an ongoing challenge, not only to the family, but also to all of the systems. Thank
And
you.
then finally, Leland King with US Aging, he's one of our partners, elevates some important partners to have at the table when working with kinship families, including area agencies on aging. So just want to elevate that for folks in the chat.
Great, thank you. So some key elements here, you're seeing even in this discussion, the making sure your underlying values and leadership discussions about what those values are and why do this is you need that top level support and to have the buy-in throughout the system. So we're having daily practices that helps everyone in the collaboration focus on the process of healing, that families who are in the situation where they're called on to provide the grand family, kinship support, kinship placement, have undergone challenges that deplete their energy. And so making sure that we're taking care of and helping families get the support and help and healing that they need to do the job that they're being called on to do is extremely important. So that, and not to forget the children who in those situations who need our support as well. And different systems can provide that kind of support to the children in our kinship and grandfamilies. And so we want to build the community supports and the family supports to we're building joint accountability for shared outcomes. We're linking information systems and training staff. We're budgeting for programs so that they can be sustainable in this work and to help work with related agencies. So as each time we have to evaluate who would be that, who would the partners be that would be responsible to this family's needs. So we're going to ensure the care coordination, make sure that we're responsive to the need. We're facilitating, it's a process of facilitating who does what when. And so that takes a lot of communication. It's a partnership with the grand family that builds strength and self-reliance. And that's one of the most important pieces to keep in mind, that the collaboration is not just to come in and meet an immediate need, but it's to leave the grand family stronger and to be more self-reliant in the future. It's a process of engaging all of those helping resources and building rapport and helping alliances, not just with the grand family, but with the other service providers. Now we talked about, someone asked earlier about some of the challenges to collaboration. There's a lot of them. One of them that gets in the way very early is the conflicting values that can come from different agencies. And for those families who are being served in the child welfare system, child welfare frequently gets the reputation that they're the kid snatchers, that you have to protect your family from child welfare rather than embrace the services that can be offered. And that, particularly in some collaborating or potential partners, and we find this in working with substance abusing families, that there's actually a lot of distrust across systems. And so you have to work on that historic distrust across systems, that many times people have had their own personal negative experiences with another agency, and then you have to work to really overcome a negative history. The implicit bias that can come with work with any one agency. If you have a mental health issue, it may people in another service area may have an implicit bias about some disability or some mental health condition or circumstance that someone's dealing with. So check what the implicit bias is, and it can be, this goes also to cultural and racial biases, that because of the services that people have encountered, I think one of the worst barriers to collaboration is the agency says, "Oh, we've known that family for 10 years." It doesn't get us to solutions if we have that underlying bias. It's hard to get out of our funding silos. It's hard enough to get out of our funding silos without those biases. And somebody asked earlier about information sharing barriers. Yes, and the National Center for Substance Abuse and Child Welfare and NICLA have developed resources. Ours are tribal specific, but the national centers, it's a guidance for how you can share information across programs, a set of sample forms for releases of information, who can share what kind of information under what circumstances, what are some of the federal barriers, because different programs, for example, that are funded for substance use disorder treatment have a different set of privacy requirements than, say, child welfare. So it is, I would direct people to the National Center's website, and it's really basically how have other people solved these problems. And I'll stop there and check in. I'm going to come back in just a minute and talk about a little bit about the difference between privacy and confidentiality.
We're getting a lot of chat about, how judging these families is a big issue, and that taking in grandchildren or kin can be seen as enabling by many professionals, especially when one or both of the parents have some kind of addiction or involved in courts somehow, which is, and then Janet Salo recommends resources from Nar-Anon and Al-Anon,
yes,
to her families that she serves in Minnesota. Let me see.
Really good resources. Yes.
Right. Let's see. One challenge we have faced when working with Native families is they do not trust the government or agencies representing the government. Additionally, they don't trust white agency workers, understandably. And are there any specific suggestions to help with those barriers?
Well, it's part of this historic distrust issue that I'm describing, and the importance of collaboration across jurisdictions. So if you can come into a collaboration with a tribal program or an urban Native program, by all means, try to develop that connection. And given that in, the disproportionate involvement in the child welfare system is still pretty dramatic. And, in, if you are a Native family with a substance use disorder, you are 8 times more likely to have your children removed by the child welfare system than if you're a white family with a substance use disorder. So same disorder, but 8 times more likely to be removed. So this the notion of historic distrust and overcoming that distrust, you actually have to reframe the notion of distrust as a desire on the part of the family to protect the integrity of their family. So if you're protecting your child from the potential breakup, then there's something there to work with. In other words, you want families to protect their relationship with their children, and their extended family are part of that. So part of overcoming distrust is making sure that the placements are really necessary, and are you doing them without the implicit bias that can come with cultural differences? Thank you for that question. That's an important question.
Leland is also raising the confidentiality issue again. When he was a care manager, it was frustrating to him to learn that another systems agency was involved, but they couldn't confirm their involvement because of confidentiality issues. So I know that you're going to be talking about that, and that is
Yes, I will. As a matter of fact, there's a lot of different agencies that might be involved in who we work with, and they all have different requirements on this of how they share information, and we can get caught up in that. So I'm going to actually jump over this because I think I've got. I want to go to that. I'll come back. Here's my slide on the difference between privacy and confidentiality. So privacy is the reasonable expectation that your personal or medical information is not going to be disclosed by a provider. And this is at an organizational level. So how we protect records, how we protect information, who gets to see somebody's information on the call to talk about insurance or something else. Confidentiality is a professional obligation not to share information you gained in the process of a helping relationship. And the ultimate reason for confidentiality is to maintain trust and integrity. The only thing we have to work with in our profession as we serve families is really our relationship with those families. And if we're not faithful to protecting the information that we gain in the process of that relationship, why would someone want to tell us what's wrong and what they need? And now the reason I make the distinction between these things is the laws that we have to follow are about privacy. And because there are legal frameworks around privacy, we can structure around it. And so for example, on a wraparound team made up of people from different programs, the members of that team can sign a confidentiality agreement that then is compliant with the privacy issues, and that that the team confidentiality, the team privacy agreement is something that they agree to adhere to the confidentiality issues and the privacy requirements of each agency, so they don't take things outside of the team. And those agreements that happen in teams are they're codified at the policy level, sometimes by joint appointments. So in other words, if you have somebody in your mental health program who's going to serve on the wraparound team with say your child welfare program or children's mental health program, you might actually have 5% of their time that is assigned to the other agency in an interagency agreement that's a no-cost agreement, but it brings them into an umbrella. So that's why I say, looking at what different agencies have done to overcome the barriers. Now, the best way to overcome this barrier is for the parent themselves or the grand family to create their own wraparound plan or coordination plan in which they request that the agencies involved share their information with each other so that they get good services. Now, negotiating this agreement with the grand family then opens up, you can, some jurisdictions have developed forms for families to sign as part of their service agreement that then grants who can have access to the records for the purpose of wraparound or for the purpose of collaborative treatment. And rather than having to sign 6 different forms for 6 different agencies, they're signing one form that they're driving the purpose of the sharing of information. So again,
Ross, why would you think he has?
this I'm going to I'll jump back. Anna, go ahead and see if there's additional questions with my response there.
We have one more question pending, which is how valuable is it to use peer advocates from the culture to assist in family engagement?
No, I think it's very valuable. These are if you're working across the cultural barrier and you don't have if you don't have the culturally specific service providers in your own agency, making sure that you have navigators and we often think about kinship navigators, for example, as being a person who helps the family navigate the system, but they also help the system be responsive to the cultural needs of the family, because they can interpret things like help-seeking behavior, who's related to who, what the cultural resources might be. So I think those in many places, kinship navigators, for example, it may be a paid service, but it also may be a peer support kind of service. So great question. So I just want if people would put in the chat box who you think your opportunities for collaboration are, and if you have barriers, to go ahead and just to put that in the chat, and it will be very valuable information to us at the Resource Center, at our Technical Assistance Center, as we go forward. And I'm helping. I have several more slides, and I see we have about a little more than a half hour left. So what are the building blocks here? Well, understanding and documenting the needs, feeling the urgency or the readiness, and our grand families are helping us do that. And the reason that this Technical Assistance Center even exists is because grand families said we need it. And we didn't take no for an answer. It took many years to advocate for this level of service to be out there, to get the kind of response that was needed. So developing advocacy really does develop the readiness of the system, the urgency to respond. Funders have to buy in. As somebody mentioned earlier, we have to be trauma informed to go forward with this. we have to think about care coordination designs where we are, it's not just case management. We are actually trying to coordinate the care across agencies. And then we also need to make sure that the people working in different agencies have a sense of what their partners do, and to be able to screen for the things that their partners can respond to. In many cases, a common assessment process, so that when a family doesn't have to go through 4 or 5 assessments, there's one assessment that has questions or considerations holistically across a variety of needs. Because we have open communication, and we have established those lines of communication. We have to figure out this issue of confidentiality. And another comment about the privacy versus the confidentiality. We can collaborate without sharing confidential information. It's the privacy issues that have to be overcome. In other words, we don't tell people in the collaboration what we're talking about with our clients, with our families. The fact that they're getting service is a privacy issue, not a confidentiality issue. I hope that I'm trying to make that distinction, because it's a different issue overcoming the privacy issue versus the professional responsibility we have to people. In other words, our relationship is sacred. So even in coming together and working with someone else, we don't have to talk about the things that are hard that they've shared with us. And the Grand Family tells us what they're comfortable sharing, and may be encouraged to share themselves. Shared case plans, shared plans for families that really help this, so that there's, as in wraparound, there's one plan instead of 5 or however many, and that we've got these arrangements around data sharing. Leadership support is essential. Cross training, we've talked about. Staff buy-in, training and technical assistance. I think one of our main hopes for the National Center is that we will be able to provide some technical assistance on developing collaborative approaches. We've talked about budget and funding and shared vision and that cultural integrity, a commitment to that healing and respect for each other's missions across our different agencies, and having a clear set of collaboration principles. The more we can just have that clarity about why and how we work with other agencies, the better equipped we are to do it. You have to have a clear authority to collaborate. Authority comes in government programs, from law and policy. In nonprofits, it comes from our founding documents and our bylaws. Whenever possible, be explicit with the authority to collaborate. If you're in the process of revising policies and procedures, by all means, add to your policies, sections on participating in collaborative arrangements with other departments or other agencies or programs, because once it's written in policy, it's much harder for people to say, oh, we're not allowed to do that. I just have recently been working with a program to rewrite some policy, and they're very explicit about the responsibility of agencies and departments to be responsive to the needs of the people they see requires that they enter into collaborative working arrangements. And so they've written the language so that that it's part of fulfilling the mission of the in this case, a governmental division. So, so write it into policy. That's my advice. Structuring collaboration, you have a lot of options. It can be very formal. We've worked with some communities to write a charter. When you come together in a, for example, in a wraparound situation, you got to decide, what the rules are and how we're going to work together. A charter is one way to do that. It's not a legally binding document, but it lays out how you're going to engage with one another. So usually it's a statement of values and vision and mission, and then how often you're going to meet and what kinds of services are going to be collaborative. So a charter can be a very valuable thing. You might want to get more formal and write some bylaws, for some teams have bylaws. Probably the most frequent way to organize the collaboration is through a memorandum of understanding. And I work with one program that has a memorandum of understanding with 32 organizations that respond to the needs of children and families. And it's only a couple pages long, but everybody who's signed on to it is agreed to a set of principles of how they come together in interdepartmental collaboration. And so it allows them to have this umbrella memorandum of agreement that then gets much more specific with regard to each family. Sometimes you don't need anything in writing, and you rely on what's on protocol. And protocol is simply, around here we do it this way, but you need a strong leader or a strong cultural framework to hold to that protocol. Frequently you see this operating again in smaller communities where leaders have come together, decided to provide services, and they find mutual values, and they have a verbal agreement, and they're really invested in their relationships and their roles, and they try to ingrain those in the system. They're vulnerable to change, but it's there's no, and I'm saying there's lots of ways to get to the idea of working together, decision to act jointly, call it. So you want to know whether it's working or not. So you're trying to develop feedback loops, understand the issues of quality control. How do you get it to happen? If you're able and have resources to perform evaluation, you want to know whether it is happening the way that you planned it. That's the word fidelity. Are we true to what we set out to do? So the feedback loops in knowing whether it's working. First is at your supervision level. Your supervisors are checking with line staff about, are they engaging in collaborative work? Is it working? Your team meetings are another place to check in to get feedback. The teams giving feedback to one another at the management level. This is mid-management level. Your managers need to be checking in. Are we doing it? Is it working? Is it helping? Community member check-in. So we're meeting those people who are being served. Maybe we're doing some kind of survey with people about, are they getting the services that they need? Is the collaboration working for them? Having partner check-ins. How are we doing working with one another? And developing fidelity measures. So a fidelity measure is usually something that is a checkbox of, did we communicate? Did we send the forms? Did we attend the meetings? Whatever the approach that has been adopted, did we do it the way that we planned it? And then sometimes we have the resources to engage in some outcome evaluation. And I want to just share what the role of evaluation is in this when you're integrating collaborative practice. And I want to start down at the bottom here where it says collaborative implementation. So you select your form of collaboration. You can outline how it's going to work, and so this is your planning process. Before, as you implement it, you have pre-service training so that you're training your staff. Here's how it's going to go. And then as you're launching, you're providing consultation and coaching to the people who are implementing this. This is usually at the middle management or supervising level. And as you're going forward with implementation, you're checking in with staff. How's it going, and are you able to do it, and what do you need? And so this is in supervision. You may be using fidelity checks to make sure that the work is going as it was planned to go. And then from a broader perspective, you've got some kind of program evaluation. This may be surveys with partners or with families, checking in on how it's going. And then you're facilitating the administrative support, because as you're doing this, you're learning. And so this is about continuous quality improvement. You're always going to find things that will help a collaboration work better, changing a communication strategy, a reporting strategy, a meeting schedule. So trying to make sure that you're doing the structural changes needed. And then tells you that your system level intervention, your collaboration is or isn't working for you, and how to make adjustments along the way. I'm gonna stop there for a second and see if there are questions about this process of. I certainly hope it doesn't make anybody dizzy doing this.
Well, we've certainly had a very lively chat talking about the legal service needs of the families and lots of challenges that the families face. I don't see any pending questions right now, but
Okay.
if someone would like to come off mute and ask a question directly, they're welcome to.
Hi, Dr. Cross.
Hi, Anita.
How you doing? I was wondering, how could we engage peers or train some of our peers to be part of the evaluation team?
Great idea. This is there's when I was doing some work with SAMHSA on system of care issues, they were training peer support providers to participate in evaluation, and they have and I'm trying to remember the families. The name will come back to me, and it's the organization, but they have a curriculum on how to engage family members as partners in evaluation. And it is their approach is to have people learn about evaluation and what's possible to evaluate, at what levels you evaluate. So, a process evaluation, for example, tells you how you did it, how many people, and did you do what you said you were going to do? Did the products or the services get delivered? The outcomes evaluation is also very varied and graduated. So this kind of the simplest is, do you think you got what you need and needed? And that's usually the level at which funders, especially private funders, ask people to evaluate things. When you begin to make the transition into a research of outcomes, the research level where you're trying to determine what actually happened, what changed. This is where I think that our families are most valuable, because if you have a researcher deciding what a positive outcome is, and they're sitting at a university or a beltway consulting firm someplace, they're measuring things that are of value to them. What I think is most important is to measure the things that are important to the people that we serve. Now everybody gets to have stuff, I think, in the pool of what gets measured. But we will, if we don't ask our grandfamilies, what's important to you? What outcome is most important to you? Then we're going to miss what to measure. So that's my thought. Thank you. Great question, and appreciate that. Okay. Well, I'll jump back in. We have just a little bit left here. So having a communication strategy is a really important element of collaboration. It's who talks to who about what. And I said the importance of budgeting, but the line staff don't talk to one another about budgeting. And the executives, they may talk about committing resources and staffing, but they're not the ones who really do that. So it has to be your finance person and who's talking about budgeting, your manager's talking about staffing. So making sure that you have the capacity to talk across your organizations with the right people to get involved. Because if you don't have buy-in from your fiscal department, for example, you might not have the right accounting codes in your accounting system to pay for things that would be under the label of collaboration. So things like counting in-kind contributions, things like supporting flexible funds where there are gaps, where teams of people are deciding what needed. So all of those policy and administrative level issues, working to overcome those barriers of sharing information and data and tracking outcomes and things like that. You can count on in collaboration having conflicts. And so having some way to resolve those conflicts so they don't derail the work, and figuring out where are we going to bump into one another, where are we most likely going to come into those conflicts, what are things that I am going to be called on to do that my funder just won't let me do, and being very real about those and having a way to solve problems and make decisions. Scheduling and timing of services can be monumental. That's particularly at the line level. So the family may feel an intense need for a mental health service, and someone else in the system is pushing, say, a school provider is trying to get the child ready for a particular school event, and if you poke your finger in the sore spot in the trauma, it may derail the importance of the school work on an academic issue, for example. So the deciding of when we're going to push on a particular issue that a therapist is working on versus the school testing day, having those collaborative discussions about when do you push and why. Another example is visitation. What's the visitation plan with the parent, and scheduling that. Do you schedule that on the day you're going to have your immunization shots? Probably not. These are just real life issues that you want to make sure that you're having discussions about. So all of those screenings. So what does it mean to have open communication? It means we can pick up the phone anytime. And what does it mean to have an open approach to budgeting? A friend of mine, and a person who's known as the grandfather of wraparound. Some of you may know Carl Dennis. Carl says collaboration means you put your wallet on the table and your hands in your pockets. So in other words, you put your resources out and you invest in that process. So you're there to communicate and to bring resources. I talked about this. So I said I'd talk a little bit more about leadership. Leadership's job is to make this easier, to hold space for people to be able to collaborate. And in order to hold that space, and what I mean by holding space is that you schedule meetings, you ask people about what their progress is in collaboration. You're encouraging people with accessing resources. A leader might say, "Do you need technical assistance to do this? We can find that if you need that. What do you need in terms of budget? What do you need in terms of staffing? What will it take?" And a leader has to have some amount of risk tolerance, because whenever we enter into a relationship with another helping agency, there's a possibility that things will go wrong, and we want to have mutual accountability, reciprocal accountability with one another, and to share the risk across the organization. So having that open understanding that we are taking on a certain amount of risk in doing this, the return on that investment is worth it. So developing that risk tolerance and mitigating the risks as much as possible. The last concept I want to share, and something we've lived by at NICWA, is giving away the problem. If there's anyone out there who's willing to take on some of what it is that's our mission, we will be glad to give it to them and to help them in any way that we can. So that might mean a collaborative arrangement to help another organization grow. It might be helping another organization develop a service that they haven't developed before. It might be working with a funder on a jointly funded project that then one of our collaborators takes on. The more we foster other programs to meet the needs of our families, the more likely we are to accomplish our mission. I've always been a proponent, and I have had agencies say to me, well, we're in a competitive environment, and my response is always, as long as there's one family in need that doesn't get service, then we shouldn't argue about who's going to provide it. We should be supporting one another to get that service out there. And I've yet to see an environment where there was enough to go around. So it means that giving away the problem, the more people we can engage in the problems, that the more we can become strong partners with grandfamilies, the more likely we'll have success. So I'll pick one more question, and then I'm going to give a preview and some resources.
We've had a very lively chat. I'm not sure that there's a pending question, although I may have missed it. So if I've missed your question, I encourage you to come off chat and ask it directly. I mean, come off mute. Come off chat. I don't believe there's any question.
Okay, great. Well, we just have a few minutes left, so I want to, first of all, I want to give a little preview. We're going to come back to you in the spring with collaboration 2.0 from our point of view. So, and it's going to be specific to those of you who are collaborating directly with tribes. And we're going to be sharing with you, and you can get access to this resource, a toolkit for American Indian Alaska Native grandfamilies that has information on sovereignty. In other words, collaborating at a government to government level. And it's important to understand the policy environment where where tribes are dealing with federal funding streams that are different than the funding streams that come to state agencies. We'll take a look at the historical issues that impact collaboration and major worldview differences that impact the way that we define service and how we think about that. We'll be looking at communications strategies, particularly cross-cultural communications, and building that trust that someone asked about earlier, and looking at some outcome strategies. So just a little preview of what we hope is a webinar next spring. Then some resources from the National Center for Substance Abuse and Child Welfare, from the Center for Children and Family Futures. These are really, and I think we have these links going in the chat box as I speak. So things that you can get access to that will give you more information about the model of collaboration. And then some of those are tribally specific resources from the National Resource Center, or for the National Center on Substance Abuse and Child Welfare. And these are available that can help with these collaborations between child welfare and the substance use disorder treatment agencies. And so, thank you very much. This happens to be my mom and my grandson. My mother passed away in 2019 at the age of 94 years old. So one of the important teachers in my life. So I want to thank everyone for joining in this collaborative session today. I think we have 5 minutes left. Anna?
Thank you so much, Dr. Cross. And we're getting a lot of thank yous in the chat and a lot of kind words. So I hope you get to see that. And we're having our next webinar in 2 weeks with Joseph Crumbly, Dr. Joseph Crumbly, and he's going to be talking about family dynamics and how systems can work with the families. So I hope you will all be able to join us then. Allie will drop the chat to the registration for that webinar in the chat. And we just really thank you, Dr. Cross, for joining us today and for kicking off our webinar series.
Thank you. Appreciate it.
Appreciate you. Well, thank you all, and we hope to see you in 2 weeks.
Thank you.
Thank you. We'll leave it open for just a second in case you need to grab any links out of the chat.
Thank you.
Do you, can you send the presentation by to us or not?
Yes, we will be sending you the presentation by email.
Okay.
So you will be getting that.
Thank you.
You're welcome. We'll also have these resources posted on our new website, which is going to be launching very soon. I see a question about capturing the links in the chat, and we can make sure and do that, that you get the important links. We won't repeat ones that are already in the PowerPoint, but we will make sure you get the others that are important.